for human corneal endothelial cells. The objectives to be achieved were divided into 3 key steps. First, to accomplish the denudation of amniotic membrane. Second, to standardize the isolation of corneal endothelial cells. And third, to use this denuded amniotic membrane as a scaffold for the isolated endothelial cells. In the first step, the amniotic membranes which had been this was followed by the denudation process, where the membranes were enzymatically treated using Dispace 2 in a concentration of 1.2 units per ml for a period of 60 minutes. This was followed by mechanical scraping and microscopic examination. Step 2, which entailed the isolation of corneal endothelial cells, utilized cadaveric eyes which had been deemed unfit for surgical usage. These were subjected to a corneoscleral button excision. Following this, the buttons were placed on a Teflon block and a 10 mm trephine was used to partially pierce the endothelium, the Descemet's membrane and the posterior stroma. This was followed by the peeling of the endothelial and Descemet's sheets in a manner similar to the usage of Utrata forceps during capsular rexus. The sheets were then enzymatically digested with 2 mg per ml of collagenase 2 for a period of about 2 hours. Following this, the tissue remnants were centrifuged. A method of pre-plating was done so as to separate any attached fibroblasts from the endothelial cells. The cells were then analyzed microscopically to assess if they continue to maintain their morphology. The results showed that in step 1, a figure on the left is showing an amniotic membrane with an intact epithelium. Microscopic examination of the denudation process showed a progressive destruction of this amniotic membrane, and at the end of 1 hour of enzymatic digestion yielded an exposed stromal collagen with no epithelial cell remnants, as shown in the figure on the right. In step 2, required for the isolation of endothelial cells, a tissue quality check of the harvested endothelium and Descemet's membrane gave sheets which were of ideal thickness and showed confluent cells. These exhibited a typical hexagonal morphology with an underlying Descemet's membrane that has been shown in high max in the adjacent picture on the right. The isolation of the endothelial cells was attempted using collagenase 2 solution, and at the end of 2 hours of enzymatic digestion, the endothelial layer, as shown in the figure on the right, was seen to have slowly peeled off the Descemet's membrane. This was aided in part by mechanical destruction via pipetting. These endothelial cells were seen to be floating either individually or in tightly packed clusters. The enzymatic digestion left behind a clear and acellular Descemet's sheet as seen below. Results of step 3 showed that after seeding of these endothelial cells onto the amniotic membrane, a few of these cells managed to scaffold onto the amniotic membrane, and that they retained this adhesion during subsequent media replacements. Coming to discussion, it has been shown that the proteolytic action of the enzyme Dispace was effective in being able to denude the amniotic membrane. This denudation was required because according to previous studies, a denuded amniotic membrane is able to encourage better cell growth, which is more uniform in its expansion, and it also encourages cellular proliferation. The standardization for the isolation of endothelial cells was quite a complex process. A majority of the donors were in the older age bracket, and this possibly hindered in the cellular viability and the subsequent cell adhesion. The harvesting of the Descemet's membrane and endothelial sheets in a manner similar to capsular rexus was the most effective of all the procedures, as this yielded sheets of ideal thickness. The isolation of endothelial cells was possible through the proteolytic action of collagenase. These cells, as mentioned before, were either floating freely or within clusters. Once seeded onto the amniotic membrane, they maintained that adhesion. Many of these cells maintained a rounded morphology, while some others were quite large and irregular, possibly due to enzymatic fragility. The culture media, which was Optimem, was supplemented with various growth factors. This was done in order to encourage mitotic stimulation, particularly from this older senescent population. Thus, in conclusion, this study was successful in isolating endothelial cells and being able to use the denuded amniotic membrane as a scaffold. But there is still considerable room for improvement in culture conditions and the number of viable cells which manage to adhere onto the amniotic membrane. This could be in part due to enzymatic fragility, the prolonged antibiotic usage during the studies, as well as the older donor age groups. Further studies can still be done of endothelial cell proliferation, wherein it can serve as an in vitro model for corneal tissue engineering studies. Thank you.